And as soon as it hits 10:30, I think we're ready to go.
All right, mine says 10:30. Want to get going, Shelley?
Yes, I think we're all set.
Okay, perfect. Good morning, everybody. Welcome to the Education Standing Committee meeting. Just a couple of housekeeping announcements. This is a public meeting and it is recorded, so anything that's put in the chat, webcam, screen shared, anything like that gets recorded and posted on the AZDHS website. I'll also remind people to mute your microphone if you're not speaking, just so we can keep from distracting me mostly. And if you're attending by phone, you can press *6 to unmute yourself. We're going to have Shelley and Julia, as usual, monitoring the chat in case I miss something. And then make sure that you identify yourself before you talk, because we can't always tell who's making comments or emotions. So first I'll start off calling the meeting to order, and then we'll let Shelley go ahead with the roll call.
All right, thank you, Dr. Rice. Brian Smith?
Here.
Chester Key? Ed Mazulas? Josh Gaither is having a vacation. What's that about? Chris Ramos? Chris Long?
I'm here.
Thank you. Matt Shaw?
Present.
Orlando Alcordo?
Present.
Ryan Harold?
Present.
Sandy Nygaard?
Present.
Sharon Hollingsworth?
Present.
And Stevie Merrill emailed me that she was not able to attend today. And we do have quorum.
Great, thank you, Shelley. So I'll begin with the chairman's report. First off, the first attachment in the packet today is the attendance report. So just a reminder that if you miss 2 consecutive meetings, the Bureau will contact you and make sure that you still want to be involved in serving on the committee. For the next item, we have a new member on the committee. So welcome Chris Ramos to the committee. And then for vacancy report, there are no vacancies currently. And then we'll move on to the Bureau report. So Chief Garcia.
Good morning, Dr. Rice and committee members. I wanted to start with a brief update on some of our staffing transitions. Our team continues to work on filling some vacancies, and we're beginning interviews at the end of the month for the services section chief position formerly held by Ben Fisher. And the position continues to be open to candidates online. We've recently welcomed some new staff members to the Bureau, including Compliance and Enforcement Manager Marley McCormick and Trauma Registrar Carissa Wilson will start on Monday. Julia Vinton has also been promoted to Health Program Manager, overseeing several of our grant programs, in addition to the vacant EMS for Children position. The state jobs website currently features the Bureau positions that are open and accepting applications, if you know anyone. For some additional updates, we have several rule updates to share. For Articles 9 through 11, the department continues to seek stakeholder feedback on the rulemaking process for ground ambulances. The Article 9 work group will continue to meet on a monthly basis to provide feedback on the ground ambulance draft, and we'll seek additional stakeholder input on Articles 10 through 11 moving forward. For Articles 7 through 8, air ambulance rules are being reviewed for final comment. And once a notice of proposed rulemaking is filed, there'll be an additional 30-day review period for public comment before approval. The remaining process before adoption is expected to be extended through mid to late 2021. For Article 5, scope of practice, based on the recommendations from the statutory committees, we hope to be able to update rule based on national standards. And the Bureau is working with Administrative Council and Rules on an exception request for rulemaking to update Table 5.1. We still expect this process to include a 30-day public review period before adoption, and we'll keep the committees updated on progress related to scope of practice and rule updates. We continue to support the COVID response and have shared some updates previously on emergency orders and waivers. Executive Order 2020-63 extends the Good Samaritan Order to provide healthcare workers and EMS providers acting in good faith with immunity protections through March 31st, 2021. Administrative Order 2020-15 provides limited EMS rule waivers, including flexibility on CON boundaries through March 31st, 2021. Emergency Measure 2020-05 authorizes all levels of EMCTs to administer COVID-19 and flu vaccinations, as well as perform diagnostic viral testing with approval from an administrative medical director. We'll let Dr. Bradley and the team provide additional updates on some of our resources and protocols that will be shared online. I also want to plug that we are doing some research and have requested feedback from stakeholders on moving towards a digital certification process starting July 1. More info to come on that. I will close by saying we expect the governmental orders, including waivers, to be revised and extended as appropriate at the end of this month or early April. I think that's all I have for now. Thank you.
Thank you very, very much. For our next item, we have the Stab Blood Product Work Group update. So Dr. Bradley was going to give that update.
Thank you very much. And I'll just quickly tag on to what Chief Garcia had mentioned. We are looking at updating the COVID treatment guidelines. Once it is updated, we will also update the associated training PowerPoint that goes along with that. Those were initially published in, I believe, March of 2020. We updated them in July of 2020, but I think since that time we've gained some more knowledge, and we definitely are due to update those. So we will hope updated and posted within the next few weeks to a month at the most. So that will go out to everyone who's on the GovDelivery website or listserv once those are ready to go. In regards to the Stab Blood Product Work Group, we had our first meeting earlier this month. Dr. Gaither was the chair of that committee for us. We had really great feedback and input from both the pre-hospital committees, trauma representatives, as well as EMS physicians, and we'll have a follow-up meeting at the end of the month. The final recommendations and kind of input from that group will be presented to STAB, and then we'll also bring that back to the other standing committee meetings in July when we meet next. That was the update regarding the Blood Product Work Group. In regards to the next item, which is naloxone leave behind, one of the things that we have been looking at in regards to data and COVID-related effect is looking at opioid-related overdose and deaths, and we are definitely seeing, as most of the country is seeing, an increase in those over the course of COVID. So we are looking at what we can do in the pre-hospital setting to help mitigate that. One of the programs which will be presented at PMD in more depth by Dr. Glenn will be the program, and we wanted to just start kind of spreading the message regarding naloxone leave behind. This is something that can be done and was approved based on a previous rule and statute. We did notice that the forms that are on the Bureau's website have Chief Mullen's name, so we need to update those. We will get those updated, but we plan on the next 3 to 6 months really try to spread the message regarding naloxone leave behind and hopefully get more agencies to participate this. So if you want to hear more about a program that's up and running, PMD will have that presentation by Dr. Glenn next. And that is all I have. Thank you.
Great, thanks, Dr. Bradley. And then Julia's going to share some updates that the SHARE program is making.
Good morning, everybody. Just a couple of updates on SHARE. First of all, we are currently working on updating the webpage and documents related to the SHARE program, including for cardiac centers, heart safe recognition, etc. We also hope to reach out to cardiac receiving and referral centers in the near future to make sure that we have updated documents and information for them. For EMS for Children, we are currently in the midst of the EMS survey. It actually closes tomorrow and we have 74 respondents. So thank you to everybody that's participated and helped spread the word about that. We also will be participating in national data collection for hospitals as part of the National Pediatric Readiness Project. That survey will open on May 1st. So if you work for a hospital emergency department, expect to see some promotional materials for that in the near future. PACES had a children with special healthcare needs work group that put together a tracheostomy management training. So we will be looking at that later on in today's meeting. And lastly, I just wanted to say we worked for another grant as part of the Governor's Office of Youth, Faith, and Families ACEs initiative to develop an ACEs Adverse Childhood Experiences training. So that's currently posted on the website. That's all.
Thank you, Julia. And then the last item I have in the Bureau report section is the data dashboard updates from Vatzel.
Batzel, are you on the call?
Yes, I'm here.
Okay, I will display the web page. Let me know if you need to click on anything further.
Perfect. I can't see it. I can see the link. Is it there, Shelly? Yeah, all right, you get doing it. So just a quick update on data visualization page on our website. We have several dashboards now, trauma overall, EMS overall. Then we have a specific dashboard on motor vehicle traffic accidents and falls, another dashboard on ethnicity and trauma variation. So you can see that over the period of time, we are increasing the number of dashboards so people can have the data, look at the specific injury, look at, if they want to change by the year, they want to look at the ethnicity, they want to look at the particular injury. They should be able to pick those kind of queries and look at our trauma picture or EMS picture for the state of Arizona. Our plan is to add more and more dashboards, this year. If you guys have any input and would like any comments on that, it's most welcome. We are always looking for any performance improvement project or the, any reports you guys are interested, we are happy to do that. So that's about it for the data visualization.
And I'll just kind of chime in a little bit with Vatzel. She is, I think, underselling all the work that her team has put in with COVID. They've helped a lot with multiple, just not only the standing bureau reports that she and her team put together all the time, but also a number of COVID reports throughout ADHS. One thing that Vatzel and her team are tracking and we look at throughout the COVID response has been out of hospital cardiac arrest numbers. Year over year, 2020 over 2019, those numbers were significantly higher. And we have also seen that trend continue January into February of this year. The numbers in February were still higher than previous years, but it's starting to trend down compared to January. The other component is also looking at the opioid-related cases. The next piece that Vatzel and her team are starting to look at is specifically refusals and how COVID has affected that. I think most of us are probably feeling when we work in the emergency department that we see more EMS crews calling for high-risk refusals, things like chest pain, dizziness, stroke-type symptoms, opioid overdoses, things that classically patients would go to the hospital. And we're seeing patients who are hesitant to go in. So hopefully as we collect more data, we'll be able to present that at the next round of meetings and certainly come up with some public messaging to potentially help support people getting the care they need. So thank you, Vatzel.
Thanks.
Yeah, thank you, Vatzel. Okay, if that's it for the Bureau report, we'll move on to our relatively lengthy list of discussion and action items today. So the first one I have here is to discuss, amend and approve the education meeting minutes from November. So if you've had a chance to review it, I can take a motion anytime to approve them.
I motion to approve. This is Sharon Hollingsworth.
Thank you, Sharon.
Second, Brian.
Thank you, Brian. All in favor of approving the meeting minutes from November, say aye.
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 Any opposed, say nay. Super. On to the next one, which is to discuss and approve a new educational module developed by the PACES work group for tracheostomy management for the pre-hospital providers. So that's in the attachments as well. And I will let, I think probably Julia go through this, right?
Dr. Woolridge, would you like to go through the training?
Yeah, I'd be happy to. Thank you. Appreciate the opportunity. So as a component of the Pediatric Advisory Council, we wanted to essentially be able to offer additional resources to the other partners within the Bureau. So one of that was to do some educational components, and the main goal going forward is to not only offer pediatric related education elements to pre-hospital individuals, but also make these CE compatible. So an individual agency may get them from the website and be able to tap into that to apply to their CE. And that's what this slide set is. For here, this project was to take on some of the major challenges that pre-hospital providers have when it comes to tracheostomy management and tracheal care in the special healthcare need child. So we can go through the slide set pretty quick and just stop me at any point if you want clarification. It starts with objectives. Again, we want it to be CE compatible, a little bit of background on, yes, you can go ahead and scroll, thank you. A little bit of background on special healthcare needs. Next slide. And we talk about the types of special healthcare needs. Next slide. And anyone on the phone, Dr. Rice, particularly, if you want me to go slower through this, just let me know. I don't want to abuse your time. So again, background slide. Next slide. Additional considerations that we have. Next slide. And then interaction with the family. I think a big stressing point when it comes to special healthcare need children is that the guardians are really the main knowledge source for the care of that child and what is the base management of the child and their baseline activity. Next slide. So focus on interactions with the caregiver. Next slide. And then we go into kind of the meat of tracheostomy for the remainder of the presentation. Diagrams, background, what's the device look like, what it's used for, how to manage it, the components of it. We've linked the non-proprietary open access videos and sources that we have. Here you see a link that goes to Hopkins to help describe. Keep going. Additional images regarding the types of devices and how they vary. Keep going. The sizes that we very often will encounter in the field. Again, more information about the device. And this, you know, again, the parents very often will have a listing of their device. Maybe our pre-hospital providers are more familiar with AICDs or other types of defibrillator devices in which they actually know the manufacturer. Well, we do this with children too, and this one's the home card for Phoenix Children's. You know, what entails a go bag. So parents will have backup devices and equipment to maintain the supportive elements in their go bag. And how to resuscitate a patient. Keep going. And then the emergencies that we encounter. And from this point on, we have slides on how to manage obstruction, how to manage displacement of the tube, Keep going. More on suctioning. Keep going. Techniques to use, and then the next component is how to how to vent a child, how to suction, how to vent, how to remove them from their home device. These two slides you just see here, we actually have links to non-proprietary open source videos. You'll need to have internet access for this because it links to the postings on YouTube. But these were, we reviewed these videos and felt them to be of quality videos. The two you see here from Cincinnati Children's. Keep going. And then how to manage a displaced tracheostomy tube, essentially how to troubleshoot it. Keep going. Another video, also Cincinnati Children's, on trach tube exchange. How to change out a trach tube, and that very often can happen in the field. How to manage bleeding from the tracheostomy site. Keep going. And troubleshooting, troubleshooting hypoxia, and that includes comments about the home ventilator. Next slide. A list of resources that we have, and the conclusion slide. The last component, I think, of this that I've envisioned putting together is a short, maybe Q&A or frequently asked questions that would accompany it, and that would just round out it as a complete packet for CE for any agency who wants to distribute the education to their pre-hospital providers. Julie, anything you want to add to that?
No, that was great. Thank you.
Thank you.
This is Gail. A big thank you to the entire PACES team for working on this training curriculum. So I think it's excellent. We had really good feedback from throughout the state. And I think this is one of the curriculums that when we put up on the education tab for our website, I think we'll definitely advertise this because people are always looking for this type of training. Just from a housekeeping perspective, if the committee approves this in this format today, this will then get posted as is. If we do create the questions, which I think would be a very nice addition, at that point, we'll have to bring those questions back to this committee for final approval before those get posted. But in the interim, we can definitely post this training curriculum.
Yeah, thank you guys very much. Does anyone else have any comments or questions? Or my only comment that I had was the title of the slide being tracheostomy management. I don't know if we want to be more specific to pediatrics, just so that it's clear when people are seeing it on the website that they know it's a pediatric module.
Very, very good feedback, and I think that's very appropriate. Yeah. Sorry to not have better titled it.
People are always looking for PED CE anyway, so if they're looking for PED stuff, that might be something that would additionally draw their attention.
Hi, it's Brian.
Hi, Brian.
I have just kind of one concern on the layout in regards to the fact that there are procedures in here that are not appropriate at necessarily any given level. Would not be appropriate. This implies pre-hospital provider covers everything, but it would not be appropriate for an EMT to be doing tracheal suctioning, replacing the tubes, I think, and so on. I'm wondering if there's a way we could put that in and start out at the BLS level and work up to show the more advanced procedures so that they're separated out by the appropriate level.
Brian, yeah, Brian, I appreciate the comments and very appropriate. There was one component of deep suctioning for the tracheostomy tube that I was also hesitant because we don't very often even do that in the hospital. So I totally agree with your stance in this regard. Would it be a solution to have the education in place but, you know, in very obvious, bold comments right after the objective slides, you know, again, in the opening slides, that this work needs to be done within your agency's guidelines and at your training and your level of training. Would that be an appropriate qualifier as opposed to removing material? And I'll defer to the committee. Thank you.
No, I wasn't talking about removing it, but separating it out so that it's stepped. When you get to the procedures to address problems with the tracheostomy, that it start out at BLS. But that's fine if you put something in there to make sure that people understand when they go into this that it's not appropriate for every level, I think would be fine. Or if you designate any specific procedure in there, this would only be appropriate at the IEMT 99 and paramedic level, or whether it be EMT, advanced EMT, because some of these would also probably be STRs, maybe even at the AEMT level.
Thank you, Brian. You know, one, I think to tag onto Dale's recommendation, I think what we can do is after the objectives have a slide that just very clearly states all procedures described within this presentation, you must adhere to what's delineated within your scope of practice, and if approved by your agency and medical director. So I think that would be the caveat that should cover the STRs as well.
That's fine with me.
I think it might be simpler than trying to delineate in each slide, but that way up front an agency knows if they're putting this training out to their organization that they need to delineate within their organization who can do which skill set. Thank you, Brian. You always make sure you keep us out of trouble. I appreciate it.
Does anyone have any other comments? Questions for Dr. Woolridge or Julia? It is really great. I like the videos. Helpful. Do I have anyone who would like to make a motion to approve this training with the amendments that Brian had suggested?
Hi, I make a motion to approve. This is Chris Long with the amendments that we discussed.
Second, Brian.
Thank you, Brian. All right, so we can call this to a vote. So all those in favor of approving the training, say aye.
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 Are there any opposed? Great. Thank you all very much. That was really great work. It will take a lot of work to put that together. So I can move on to our next discussion and action item, which is going to be to discuss, amend, and approve forming a work group to update training on the VAD patient education training. So we had some discussion about making some updates, and there were some other Arizona stakeholders that were very interested in contributing to some updates. So we thought it would be best to potentially reform a work group to kind of go through some updates, because it seemed like they had some significant comments to make that would require a little more than just a few updates. So I can open this for discussion if anyone has any specific comments about this action item.
Just to give a little background on this, I think when we initially created this at the Education Committee, we had representatives from all of the VAD centers throughout the state, and they had all come to an agreement on the training curriculum. When Shelley sent this to all the VAD center coordinators again for feedback, several of them had said that they had utilized this curriculum, but they had actually made it shorter because they felt it had gotten a little lengthy, and that there needed to be some updates regarding total heart devices and some other technology changes. So I think we had really good support from all the VAD centers previously, and I believe all of them replied and chimed in that they really were excited to kind of revise this with the EMS community again.
Mm-hmm. Yeah, and also in the meantime, the American Heart Association has come out with some official EMS recommendations for how to care for VAD patients in cardiac arrest. So I think sort of utilizing some of that in addition to the feedback from the VAD centers would make some good updates. So if there isn't any more discussion, I'm happy to take a motion to approve forming a work group.
Brian, so moved.
Thank you, Brian.
Ryan, second.
Thank you. Okay, all in favor of approving the formation of the work group for the VAD patient?
Aye.
Aye.
Are there any opposed? Great, thank you all. Our next action item will be to, again, discuss, amend, and approve.
Sorry, Amber, sorry to interrupt. We just need volunteers for that work group, for the subgroup, yes. So just need any volunteers from this committee that would like to participate in that work group.
Yeah, I'll participate in that one.
This is Ryan. I'm happy to help.
This is Sandy. I will also help.
Thank you, Ryan and Sandy. If anyone else is interested, go ahead and definitely shoot your name and email to either myself or Shelly, and we can get you on the list and participating in the work group. Usually they take obviously a couple of meetings. We try to keep it somewhat limited, but usually a couple of meetings it takes to kind of shore up the education and make the edits. It's always nice to have good participation. All right, so the next training or the next discussion and action item will be to discuss, amend, and approve another work group for naloxone leave behind training curriculum. So I'll open this one up for discussion. I don't know if Gail, if you have any specific comments on this as it relates to the Bureau.
Sure, I can give a little bit of background behind this. So as I mentioned previously, we're really trying to encourage the formation of naloxone leave behind programs. There have been some initiated in Southern Arizona. And one of the recommendations that was brought forward was to potentially create a training curriculum. Dr. Glenn has created one that she's used for her agencies. I've kind of adapted hers as well and utilize that with a program here in the Phoenix metropolitan area. So we wanted to see if this group was interested in forming a group to come up with a formal training curriculum, much like our other ones. So if agencies do want to initiate this program, there's one ready to go that they can download.
Anyone have any other additional thoughts or discussion? Anyone else using training that would like to participate in a work group or?
Gail, this is Sandy. I just have a question. Where is this naloxone coming from? Is it supplied by the state, or is it something that has to be purchased by the various agencies?
So any agency can apply through ADHS for the Office of Injury Prevention for naloxone, and that is free of charge. Certainly an agency could individually get grant funding or purchase on their own. So where the naloxone comes from is up to the agency, but there is currently funding through ADHS Office of Injury Prevention for naloxone. I'll share that link in the chat box.
Thank you. That's good to know.
And if anyone would like to make a motion to approve the formation of this work group.
This is Sandy. I will move to approve.
Thank you, Sandy.
Matt Shaw, I can second.
This is Chris Long.
Thank you all. All right, with that, I will take this to a vote. So all those in favor of approving the work group for naloxone leave behind, say aye.
Aye.
And are there any opposed? And then is there anyone who would like to sign up to work with the work group in sort of creating and editing this material?
I know Dr. Glenn was willing to participate, so I'll put her name down.
I figured.
Yeah, I'm happy to participate. This is Sandy.
Thank you, Sandy. All right. And again, if anybody else decides they want to or knows anyone else that might be particularly interested in this program, go ahead and let us know about it. And then I'll move on to our last item, which is just a standing item to review the posted training modules. I'll give Shelley a second. So this is our current list of training modules. I think we've done a pretty good job this year in catching up to date most of them. Some of them will probably be up for review in the next couple of meetings. So we'll sort of work through those processes. If anyone's particularly interested in taking on any of these, please let me know. Happy to help facilitate making those edits and bringing them back to the Education Committee. And then I'll ask if there's any agenda items to be considered for our next meeting. And if not, I'll move on to a call to the public.
Amber, I just saw the question from Sharon in the chat box regarding has there been any discussion extending the rule variances as they apply to EMS education? I think Chief Garcia did mention at the beginning all of the current waivers are going to be reevaluated before the expiration date. So an update, either continuation or a revision will go through potentially at the end of this month. Does that answer your question, Sharon? Perfect. All right. Thanks.
Awesome. All right. And now for upcoming events, we have several that are listed here. I won't necessarily read them all the way through, but we do have some traffic incident management education with CE, the National Rural EMS and Care Conference, which is a virtual conference in April. And then in June, the annual Rural Health Conference in Flagstaff. In July, we have a statewide child abuse prevention conference. July, also a Western Pediatric Trauma Conference. And then October is the Southwest Trauma and Acute Care Symposium. So they are posted on the Bureau's website, and any additional trainings can also be posted there as well. Our next meeting is the 15th of July at 10:30. And if I don't have anything else from anybody, we can adjourn the meeting.
Amber, this is Chris Ramos. I apologize for being late. I look forward to working with the group, and my tardiness won't be a habit.
Oh, that's okay. Spring break time. It's okay.
Dr. Rice, this is Sandy. Could I just mention that AIMS has the Odyssey Conference, which is virtual, and that's on June the 9th. And the registration is open currently on the AIMS website.
Thank you, Sandy. Great. And with that, we can adjourn and have a few minutes left. Thank you all for joining.
Thank you, everyone.
Thank you.
God, it's about time. Yeah.